Hi everyone, my name is Farzad. I work in the innovation team at the Fred Hollows Foundation. I'm going to talk to you today about a project we did in the Philippines last year that was using participatory approaches and what happened as a result of that. Many years ago, I got a degree in design, and there was one skill it taught me that has lasted to this day. Every week in every tutorial for 4 years, we'd put our work up on the wall to be critiqued by everyone else. It was terrifying, but I slowly understood the value of handing over the pen, of getting other perspectives to improve what I had put up on the wall. This time last year, so the middle of 2018, I was using that exact skill on a project in the Philippines. I'd heard about how our health system and the UK NHS were using a version of human-centered design called experience-based co-design to improve quality of care. I knew our medical team internally was looking at quality, and our programs team was looking at how to reduce barriers of access. We were seeking new ideas to address these issues. Many INGOs program by listening to patients or participants, then designing programs themselves, followed by implementation, and then learning. The difference in the human-centered design approach is that it's more inclusive. I'd used this approach before to listen and learn, co-design solutions with participants, and then feed into more listening and learning and iteration of the approach. I wondered if human-centered design could play a role in our programming. That's what we set out to understand. So we worked with a consultant in the Philippines to design a series of workshops that would give the pen to patients and providers to understand their experience and let them design changes. But before speaking to any patients, we first mimicked the experience of patients. Some had to travel from faraway islands to get to the eye hospital. So on the weekend, we traveled to one of the islands. It was a 4-hour trip to get there, getting a 6 a.m. ferry and returning the next day. We experienced registering at the eye clinic, sitting in the waiting room, going through triage. We sought deep empathy with patients. Then in the first workshop with patients, we asked them about their journey in order to uncover insights. How long did they have to wait? What were they doing between steps? What were the pain points and barriers and challenges that they experienced? In the second workshop, this time with providers, we showed them what the patients had done and asked for their commentary. Are these the barriers? If not, what is? Are there things that can't change? Both of these workshops clarified the specific challenges to address before moving into solution mode, which is where we move to in the third workshop, this time again with providers. If we could solve these key challenges, what would it look like? We did rapid prototyping, creating low-fidelity versions of solutions that we then tested with patients. We did this through role plays, drafting new layouts, creating storyboards of new service delivery methods. Importantly, providers didn't actually agree with patients in terms of the barriers. Islander patients told us how many hours it took, the cost, that they weren't prioritized in the queue. Providers felt this was fair and didn't want to change that. So we modeled equity of access to foster empathy, and through that process, it allowed new solutions to emerge. Finally, in the fourth workshop, we tested these prototypes with patients to validate and refine them. In total, there were 5 interventions that patients agreed with. Afterwards, the hospital chose 2 interventions to pilot for 3 months, based on what was most feasible for them to implement in the short term. One was a change to the appointment system. So upon entering the clinic, patients first went to triage rather than registration. This allowed Islander patients who travelled from far away to be prioritised in a separate blue queue to mainland green patients and emergency yellow patients. The second intervention built on the first and was a change to the queuing system to improve patient flow by using simple coloured cards outside the doctor's office. This allowed greater visibility and fairness in the queue, also improving the experience because patients could better manage their time while they waited. After the workshops, patients said they appreciated being part of the process, and after a 3-month pilot, 76% of patients thought that the new appointment system was fair. a small jump from baseline, but 100% thought that the new queuing system was good because it allowed them to manage their time, to go out, to get food, to call family, rather than being stuck in a waiting room for hours. The comments indicated that patients who had travelled from the islands were now able to get home on the same day, lowering the cost barrier, and it was fairer to these patients from more inaccessible areas, lowering the access barrier. These interventions were small to us, so small that we never would have thought to implement them, but they made a big difference for patients. And that's the difference with the human-centered design process. We didn't design based on data and assumptions. Patients and providers took the pen and led the design of interventions themselves based on their lived experience. Providers said they liked hearing the suggestions of patients and thinking outside the box to explore new ideas. They thought there was value in repeating the process to hear more regularly from patients. This project was a test. We made mistakes and learnt as we went along, but it showed there was potential in using human-centered design as part of our programming. There was value in putting our rough thinking on the walls so that patients and providers could take the pen themselves. We're building on this by planning a further project later this year to better understand the circumstances where human-centered design can lead to better outcomes compared with other approaches. And I hope to share the results of that with you in due course. Thank you.